everybody, welcome to episode 6 of Ask Innate.
I'm Dr. Chris.
And I'm Dr. Donna. Alright, so today we are actually going to be talking to you about ear infections. Most recently we've been getting a lot of questions about ear infections, most importantly what to do, because I know as parents you are always looking for a natural solution, and of course what to do that's going to be best for your child. So not only will we go over basics, like what an ear infection actually is, what to look for, what certain symptoms might be, but we'll kind of talk you through solutions at different levels. So solutions we would give you, chiropractically what that means, solutions you would get somewhere else. So you're going to be learning all those things, and then of course, if that ever happens to your child, you'll be much better equipped on how to take care of it and resolve it very quickly.
So first, what is an ear infection? Are you ready for this? Are you ready? It's an infection of the ear, obviously, right?
Right.
So, a little more. Typically, when people think ear infection, they're thinking, or they're referring to an infection of the middle ear. If you look it up, otitis media is typically what kids have when they have an ear infection. How does that happen? What is the actual anatomy and physiology of the whole thing? So your middle ear is a small portion right behind your eardrum. So it's not this outer ear that we see. I hope you can see my ear. You can't see my eardrum, I hope not. But that's the outer ear, so we're looking at the middle ear. So usually fluid builds up back there, and it becomes like stagnant fluid. If you guys have ever seen a pool that's just been neglected and gets all green and nasty, think of that as stagnant fluid, right? No one's maintained it, no one's filtering anything, so there's bugs and junk and algae and all kinds of stuff. Mm-hmm. So imagine that in your kid's ear, right?
Without the bugs and algae.
Yeah, without the bugs and algae. Else. So the reason that it gets stuck back there a lot of times is because of a nerve issue. Now, that may seem counterintuitive, but you have nerves that go all over the place, right? So imagine a tube, okay, and that's your middle ear, and fluid has to drain. One thing that parents are told a lot is that kids have horizontal tubes in their ear, but that's not true. Study after study shows that no, they have tubes that can drain properly, just like you and I. What happens is around that tube there's a muscle. I'll try to put a picture of it up right here. Around that tube there's a muscle, your TVP is what we'll call it for short. The long name is your tensor villi palatini. It's a mouthful, so TVP. That TVP surrounds the tube and squeezes it, okay? So if that TVP is aggravated because of the nerve that goes to it, it's going to stay contracted. When it stays contracted, it doesn't allow fluid to drain. It's not going to happen overnight, so that muscle that stays contracted, the TVP, it's going to keep the fluid in one space, it's not circulating, and then it becomes stagnant and can lead to an infection. That's the typical breakdown. We'll get into how we're going to look at that chiropractically in a minute, but that's the basics of an ear infection, and it has some nasty symptoms. So what are those symptoms?
So typically, as a parent, as I've heard you guys, of course, tell me, is one thing that you always say is you notice that your child is kind of tugging. That's, especially if they're younger too and they're not vocal at that point, that's the only way that they're going to tell you, hey, something's bothering me, so I'm going to keep pulling at it because I'm trying to help it, of course. Other times, kids might have fevers. You might have kind of redness, maybe on the outside. Hopefully not too much, because then that's a deeper infection that we're looking at there, into the bone. They might be kind of screaming because it's very, very painful, and that's the only way they can vocalize it to you. Of course, if they can talk, they're going to tell you, hey, my ear hurts in that sense too. They're going to be uncomfortable sleeping. Their schedule might be off. They're not going to be, they're not going to have as big of an appetite, so something might be affected. If they're nursing, they might nurse more. If they're on solids, they might eat less. I mean, that's not the only things that happen, but those are pretty common things that children will experience and parents will see. Of course, as a parent, the last thing that you want is for your child to be uncomfortable. So in the situation that you do have an ear infection, most of you, from what we've kind of heard, will go straight to a medical doctor. Now, when you go to a medical doctor, the first thing they're going to do is kind of grab their scope, and they're going to look inside the ear. Now, one thing that we've always heard is that, oh, they looked in the ear and there was redness in the ear. So because there's redness in the ear, they assumed it was an infection, and you're given an antibiotic and you're kind of sent on your way. What we're going to teach you and talk about is redness does not mean infection necessarily. Redness most of the time actually means inflammation, and Dr. Chris is going to go a little bit more into that in a second. But just looking at an ear, ladies and gentlemen, is no way of determining if your child has an ear infection. It's almost archaic. I hate to say it like that, but it kind of is. The only way that you can determine if an antibiotic is even going to be useful for the body, not necessarily for that ear infection, is if you culture it. How many of you who have kids who have gone, to the doctor with an ear infection, how many of you actually had a culture done? Like, how many of your doctors said, hold on, we're going to have to culture things. We're going to wait for this culture to come back, which you're going home without anything at this point, right? The cultures come back, they've called you, they've confirmed it's bacterial, then they've given you the antibiotic. That's the only way an antibiotic should be given out. Not like candy, like it gets done too many times, but that is the only way to truly determine if an antibiotic was necessary for the system, I guess for lack of a better word, is if that culture comes back as a bacterial infection. Now, a lot of the times it's not. A lot of the times it's actually a viral issue that's going on in the body. So what's happening when we take this antibiotic? First thing that's happening is it's wiping out the gut completely. Second thing, it's absolutely useless. Why would you take an antibiotic for a viral issue? You just don't do that. It's like if your tooth hurts, you don't take something for your knee. It just doesn't make sense. And then what ends up happening is now that all the bacteria in the gut is wiped out, then your immune system is much lower. And whatever was there fighting off everything in the body, gone. Stands no chance. So what happens? The ear infection reoccurs and reoccurs and reoccurs and reoccurs. And every time it reoccurs, the same solution is handed to the parent. An antibiotic, an antibiotic, an antibiotic, an antibiotic. Well, a lack of an antibiotic in your child's system is not why they had an ear infection to begin with. And in the meantime, we're just continuously ruining and weakening their immune system and their gut. And what made us think after the first one, the fifth one would work much better? It's pointless. We shouldn't be doing the same thing. We need to change things up. And by change things up, basically, I mean, even the Academy of Pediatrics, actually, the American Academy of Pediatrics, says to watch and wait. Watch and wait means if you kind of sense that things are up with your child with an ear infection, or if you've gone to the doctor and they've literally only looked and said, let's chill and let's wait, that's their own recommendation. And the more and more we talk to docs and the more and more studies and everything we read, they say that the only reason that they really hand an antibiotic out is to make sure to kind of soothe the parent. Because a parent wants to make sure that if they've taken their child to the doctor, they want some kind of solution before they walk out, not necessarily just to watch and wait, where that's their own recommendation. And as a parent, that's the first thing that we need to do is watch and wait before we go down, a little bit of a medication route. But in the process of watching and waiting, what we are going to tell you and what we're going to talk to you about is more of a natural solution on how to move forward so we catch it and it's all gone and done with quickly.
So one thing that Dr. Donna mentioned is that an infection and inflammation are very different things, right? Mm-hmm. So when we were in school learning about all these things, we were taught the cardinal signs of inflammation. One of them is redness. Now, redness does not necessarily mean infection. So when the doctor looks, and I'm going to show you real quick. Ready? I'm coming back. So one of these guys, right? So we have one too. And we can definitely look in someone's ear, a child's ear or an adult's ear, and see redness. But does that mean that there is an infection? Not necessarily. Hold that for a sec, thank you. So imagine that your child, let's say they're like 5 years old, playing baseball, and they're up to bat and a ball hits them on the arm. In a few seconds to minutes, there's going to be a red area there, right? Is that child infected? Is their arm infected? No, it's inflamed, right? So doctors commonly will look in the ear, see redness, boom, antibiotics because it's an infection. So it may be inflamed, and there are multiple reasons why it could be inflamed. Oftentimes, if a child is also teething, the inside of their ear will be red.
They might have a low-grade fever,
right.
Their sleeping might be off, the same exact symptoms we talked about earlier. They almost go hand in hand with the same times that your child is getting a lot of the quote-unquote ear infection.
Exactly. And, when we were in chiropractic school, we took a lot of classes that at the time didn't seem like they were necessary for our education. Like, we're going to be adjusting, right? But we did almost a year of microbiology. And in micro class, and again, we're not going to be looking at this stuff on a daily basis, but I know that it's important for this moment now. So in micro class, we had to do certain tests to determine if something was a bacteria or a virus. And that was taking a swab, putting it in a petri dish, letting it in a certain medium, and letting it have some time to start culturing. At that point, we could put it under a microscope and see, oh no, that's a virus or that's a bacteria. Again, a process that very few doctors do. And again, it's the overuse of antibiotics leads to a lot of different things. For me, I had recurrent ear infections as a kid. I know what these kids go through, or what your child is going through. It sucks. Every other month, I was in urgent care at like 2 in the morning just to get a bottle of amoxicillin and do that whole cycle again and again and again and again. I went on many rounds, and it wreaked havoc later in life for me. So I want to make sure that we impress upon you that that shouldn't be your first option, especially when their own studies tell us watch and wait. So, what are we going to do as chiropractors?
So, after all this information that we've given you, basically what are we going to do as chiropractors, and how are we going to help provide a more natural solution? Well, first and foremost, as Dr. Chris was telling you guys earlier, remember that TVP muscle that sits around the ear? Well, that TVP muscle has a nerve that goes to it, and the nerve that goes to it actually comes from the top of your neck. So that first bone that you have there, which is called your atlas, that's C1, that has a nerve that goes intracranially. If there is a subluxation, which if you remember, that means any interference to that nerve, or any misalignment there, do you think that nerve is going to work the best that it can? Of course not. So the signal going from that nerve, of course, to that muscle is not going to be working at 100%. So we might have, I don't know, 20% constriction on that muscle, 50% constriction. And then as it keeps getting worse and worse and worse, then guess what happens? More fluid builds up in that area. We're not able to drain. And yes, it might eventually be an infection. So the first place that we're going to look after we, of course, go through your scans and your assessments in office is going to be to assess that first cervical bone and kind of right underneath it to see what's going on. Was there an issue with the misalignment? What's going on with that nerve? Is that where the problem is coming from? And the reasons why we'll see subluxations in this area, one of the biggest reasons why for our little ones is, dun dun dun, the birth process. As natural of a process as your birth is, it's traumatic. It's traumatic for mom, it's stressful for baby, and if, for example, you ended up having to have a C-section for whatever reason, there's a lot of tug and pull. You imagine right now if I grabbed your head and pulled to try to get you out of somewhere, it's probably going to hurt you and create an issue, right? Well, then imagine me doing that, the same kind of force to a brand new baby. That area is going to be left uncorrected from the second that child was born. They may have latching issues, they may have breastfeeding issues, anything like that. And then as we get further and further along, as this interference has been there longer and longer and longer, then it manifests and develops as an ear infection issue and everything like that. So that's going to be the first and most important place that we are going to start. So it's going to be a natural solution. It's going to be completely gentle and effective. We're going to release the pressure going to release the pressure, from the nerve going to that muscle. So we open everything up and we allow everything to drain.
And in addition to that, there's going to be other factors that we're going to look at, lifestyle-wise, because we certainly know with the redness, right, what I talk about, is there's inflammation. We're not denying that. And there may even be an infection, but we don't know if it's viral or bacterial. So if we just go off of the notion that the inflammation is there, there's certain foods that are very inflammatory that a lot of kids eat that are contributing to this. So if it does come to that your child has ear infections, and we're the ones in charge of helping you solve that, like Dr. Donna said, taking care of these nerves that go actually to the ear is going to be huge. In addition, we may also recommend changes to the diet. The biggest ones, I'll give them to you right now: eliminate sugar, eliminate dairy, and eliminate white flour. Those 3 things are going to be huge in terms of getting that inflammation and that fluid out of not only just the ears, it's upper respiratory, it's all kinds of stuff. It creates mucus buildup, all kinds of nasty stuff that you don't want your child to have any day of the week, but if they're dealing with ear infections, even more so.
So that was your 6th episode of Ask Innate. Of course, if you have any questions about anything we went over, please feel free to either reply to this email, call the office, whatever it might be. If you have a child with ear infections and you've never tried a pediatric chiropractor, we would be more than happy to, of course, be of service to you. If you know of anybody, please pass this video along. At the end of the day, our entire mission and purpose is to make sure that kids are at their absolute healthiest from the start. And the more and more we can naturally take care of our health from a younger age, the better we're going to be once we get to be adults. So we look forward to hearing from you and seeing you soon. Thank you.
Don't forget, subscribe to our YouTube channel.
So there's,
I think it's
somewhere
here.
Up, down, just push the subscribe.
There's a subscribe button, and it'll give you an email letting us know when we post a new video. This show, Ask Innate, is going to be a lot more frequent, so this is only episode 6. We're going to keep going, especially as we keep getting questions from you guys. So if you have a specific thing you want us to talk about or that we've never addressed either in the office or on a video, throw it at us. Like Dr. Donna said, reply to the email, or even in the YouTube channel, there's a comment section down below. Ask us a question and we'll be happy to answer it.
Have a beautiful day.
See ya.
Bye.